Hello, my name is Dr. Sika and I am from the Department of Anesthesia at Brockton Hospital. Today I am going to talk about ketamine. Ketamine is a unique anesthetic agent. It is a close chemical relative of the hallucinogen drug phencyclidine or PCP. Now we'll talk about what are the indications of using ketamine. Ketamine is commonly used for sedation and as an adjunct for analgesia. It is perhaps one of the only agents besides the opiates which can be used for analgesia too. Commonly, ketamine is used for induction of general anesthesia in the operating room. For sedation purposes, it can be used for a variety of procedures like painful dressing changes, burn patient dressing changes, close reduction of displaced joints, etc. In patients who are hypotensive, ketamine use can increase the blood pressure and cardiac output. In addition, ketamine causes bronchodilation and does not cause respiratory depression. Hence, it is useful in patients with asthma or COPD. A particularly useful property of ketamine is its analgesic effect. Small doses can be used for analgesia and sedation without respiratory depression. In fact, intraoperative ketamine use or use of ketamine in the ER has been shown to reduce post-operative opiate use. Now, how does ketamine work? Ketamine works by inhibiting the NMDA receptors. Also, the action of ketamine is responsible for its unique state of dissociative anesthesia, where the subject is dissociated from its surroundings. What ketamine does in the brain, it suppresses the sensory impulses through the thalamus, while the limbic system is excited. So that's called dissociative anesthesia. While one system is suppressed while the other is excited. This manifests as eye opening, nystagmus, swallowing, and muscle stiffness. Now, how do we use ketamine? For sedation purposes, ketamine is diluted to 10 mg per ml and then administered as intravenous boluses about 20 to 30 mg at a time for the patient. Now, ketamine use is often supplemented with midazolam and glycopyrrolate. This is done due to two reasons. Ketamine is known to cause psychomimetic emergence reactions. That's why administration of midazolam will help to reduce these psychomimetic emergence reactions, which we'll talk about in a short while. The second thing what ketamine does, it increases the respiratory secretions in the respiratory tract. To decrease these secretions, often glycopyrrolate about 0.2 mg intravenously is administered. Now, in which patients ketamine may not be used or not preferred to use ketamine in which patients? Heart patients, particularly people who have coronary artery disease, uncontrolled hypertension and arterial aneurysm, ketamine is often avoided. This is done because ketamine actually increases the heart rate, increases the cardiac output and increases the blood pressure. It has, in other words, indirectly stimulatory effects on the cardiovascular system. However, in critically ill patients or patients who are hypotensive for a prolonged duration of time where the catecholamine stores are depleted, ketamine acts actually as a myocardial depressant. So ketamine use should not be done in patients, in critically ill patients. As we talked before, ketamine is a potent stimulator of respiratory secretions, which can be prevented by prior administration of anticholinergic agents such as glycopyrrolate. Now, also ketamine is avoided in patients with head trauma, patients with pre-existing increased intracranial pressure or decreased intracranial compliance. This is because ketamine is perhaps the only agent which increases the cerebral metabolic rate, cerebral blood flow, and intracranial pressure. So therefore, ketamine is avoided, especially in head trauma patients. Now we'll talk about the recovery from ketamine. Once ketamine is given as a bolus dose, the action is terminated by redistribution from the brain, which is about 12 to 15 minutes after a single bolus dose. The primary metabolite of ketamine is norketamine, which has about 1/3 to 1/5 of the potency of the parent compound. The last thing we'll talk about is psychomimetic emergence reactions due to ketamine. These reactions occurs after a dose of ketamine, and patient can wake up with nightmares, illusions, hallucinations and delirium. The risk is lower in children and patients who are pre-medicated with midazolam. Hence, midazolam is routinely administered with ketamine if possible to decrease these emergence reactions. So again, to summarize, ketamine is a unique induction agent, or it can be used for sedation, and is perhaps the only agent which has analgesic effects apart from opiates. It can be used for a variety of sedation procedures, patients who are hypertensive and patients who have asthma or COPD. Thank you very much.